Dr. Fildler, how did you first learn about the DCQ?
I was introduced to DC Cure at the National Legislative Conference for the American Chiropractic Association. I was fortunate enough to be there. Actually, that's where I met you. And again, sat down, you introduced it to me, you explained it. I already had a knowledge of pulsed electromagnetic field therapy. I had never seen a portable unit, one that you can take anywhere, that you can use anywhere. Read through the research that you gave me, took a few units with me back home to start testing and trying out, and that was all she wrote. I mean, the results were just outstanding.
Excellent. How long have you been using it?
A little over a year, and again.
Can you share with us your experience?
Oh, absolutely. The first person I actually put one on was one of my top athletes, who is a former professional runner for Nike, U.S. Olympian, turned professional football player, turned professional bodybuilder now, who has been dealing with pain and back issues his whole entire career. When I got home, I gave one to him immediately. I told him exactly how I wanted to use it, and within a week, his pain levels, and again, you've got to take an athlete's pain levels with a grain of salt. When an athlete tells you they're a 4, that's your average person's probably 7. They couldn't even handle that kind of pain. And within a week, he called me and said, "Doc, I woke up without any pain." And I was like, "You've got to be kidding me." He goes, "Nope. I went, I worked out, I trained, I lifted heavier than I've been able to lift, 0 pain." And that started the ball rolling for me with this therapy.
How do you compare the DCQ with other PEMF devices?
The beautiful thing about the DC Cure is it's portable. You can use it anywhere. You can take it with you. The other big PEMF devices, the clinical ones, they're great, but you can't bring it on a plane with you. You can't use it when you're in the car. You can't use it when you're walking the baby, in the stroller, when you're running, working out, anything like that. Nothing else can do that. This is the only thing out there that's a PEMF device that I've seen that you can use no matter what, no matter where.
Can you share with us the prescription? How often do you need to use it in order to relieve your pain?
Sure. We want to start off using it twice a day, and it runs a 30-minute treatment, and we want to do that for 6 weeks. And no matter how good you're feeling, you want to use it for the entire 6 weeks, and then you can go down to a more of a maintenance level 3-4 times a week, just depending on what your activities are, how you're feeling. And the beautiful thing is, God forbid there's ever an injury, something happens, you just ramp it right back up to the twice a day for 6 weeks.
So do you have any suggestions on maintenance while they are keeping weightlifting and training very heavily in order to avoid future pain?
Absolutely. Once somebody's used it properly, and by properly I mean you to use it twice a day. It runs a 30-minute treatment. You need to give that a 6-week trial. No matter how good you're feeling after even a few days with it, you want to finish that. And then most of my athletes and most of my patients are now using it 3-4 times a week. A bunch of them actually will use the unit before they even go and work out, just preparatory-wise, to make sure that the inflammation's down, that everything's ready, and then as soon as they're done working out, within a few hours, they do a second treatment right after. And again, one of the greatest things I'm hearing from them is they are recovering faster than they ever have in their careers.
My name is Miki Shainovitz. I'm a professor of physiology at Tel Aviv University, and in the past 4.5 years, I serve as a chief scientist in Aerotel Ltd, Israel. Welcome, Dr. Fildler.
Thank you. Thank you. I'm Dr. Howard Fildler. I am a doctor of chiropractic, also certified in acupuncture and sports therapy. Been practicing for 18 years now, primarily in Minnesota, and my main specialty is working with elite athletes in sports medicine.
Can you tell me, please, how did you first hear about pulse electromagnetic field therapeutic devices?
Sure. I've always been on the cutting edge of technology. I think you have to be, especially if you're going to work with elite athletes. And as I started seeing new things come out, I learned about PEMF. the benefits of it, and how it can really help not only my athletes but all my patients. And first met Aerotel about a year ago, and was absolutely amazed by the research that I read. But as with everything, I have to put things to the test, and I brought home the technology, started using it on people, and the results have been nothing short of amazing.
Can you describe a little bit more what was the clinical result on those patients that you have exposed them to the PEMF device?
Oh, absolutely. The biggest thing is I put it on some of my top athletes, guys that are dealing with pain levels that most of us couldn't even handle in a given day. And within a very short period of time, I was seeing reductions in pain levels and inflammation. They were healing faster, they were recovering faster, and in all my years, I've never been able to achieve that with these athletes this quickly.
How do you see the PEMF therapeutic devices in the field of chiropractic?
Again, to me, PEMF is cutting edge technology, and it needs to be out there. It needs to be known. At this point in time, I see PEMF where cold laser was 15, maybe even almost 20 years ago. It wasn't as well known as it should be, but the more of us that are out there, especially in the sports world, that start using it, and the more athletes and patients that are getting results with it, I think it's just going to explode.
So if you mentioned, or if you compared the laser device, can you please elaborate a little bit more about the differences between the PEMF technology, laser, maybe ultrasound, and other devices that you have been using?
Sure. I mean, I've used pretty much every technology that there is through my 18 years, from from basic EMS to ultrasound to cold laser, now using PEMF, and the results with the PEMF, again, from pain control, from inflammation control, from cellular healing and recovery, I've never seen anything like it. And the fact is, we're doing it in a fraction of the time that these other technologies would take us.
Can you please tell me how a pulse electromagnetic field therapy device can bring long-lasting pain relief?
Yeah, absolutely. Well, again, PEMF is doing a number of things. One, it is knocking out pain. Secondly, it's decreasing the inflammation, but the most important and one of the biggest things that it does is it actually starts producing and causing cellular regeneration or healing. And there's very, very few things out there that can actually get tissue to heal faster. And the differences I'm seeing using PEMF compared to any other technology out there right now, it's mind-blowing. Like I said, people are just healing faster. I'm getting injuries in athletes recovering faster than anything I thought I ever could. I'm getting athletes that have been dealing with things for years, all of a sudden in 2 weeks going, "Doc, the pain's gone. I'm back training harder. I'm back training faster." So, like I said, there's nothing out there right now, in my opinion, that can compare to PEMF.
Thank you. Can you compare PEMF to a TENS device?
Oh, absolutely.
Is it comparable?
It's apples and oranges. I mean, a TENS device, very simply, will cause very, very temporary, short-term decrease in nerve pain, and that's it. If you use a TENS unit, yeah, you may get some temporary, again, pain control. Within an hour or so, it's back. PEMF is actually not only decreasing pain, because it's taking out the inflammation, because it's causing cellular healing, we're getting long-lasting results, not temporary results.
Okay. And are you familiar with any other PEMF devices on the market?
There are a bunch of different ones. Again, there are big clinical units that are wonderful. The problem is big clinical units are very, very expensive, and they have to stay in the clinic. Patients can't take them home. And the device from Aerotel, again, the beautiful thing, it can go home with the patient. They can travel with it. I go nowhere without one. It's in my briefcase no matter where I travel. So that's the beautiful thing about it.
As a doctor of chiropractic, how popular do you think your patients are with PEMF technology?
You know, PEMF being a newer technology, both patients and the practitioners don't know much about it. There's plenty of research out there, but if you just go online and start just typing in pulsed electromagnetic field or PEMF into a Google search, you're not going to come up with a ton of stuff. It's no different than what cold laser was 15 plus years ago. When it's a new cutting edge technology, it takes time to get things out there, to get the understanding of what it is, how it works, why it's so effective. But as more and more people are using it, as more doctors of chiropractic, physical therapists, medical physicians, especially in the sports and rehabilitation world, start seeing the results and using this technology, we're going to see a huge influx of resource and patients not only using it, but patients going to their medical doctors, their chiropractors, their physical therapists, and saying, I want this. I don't want that muscle stim. I want pulsed electromagnetic field therapy because it works.
Dr. Fildler, how did you first become aware on the MDQ device?
I became aware of MD Cure a little over a year ago. I met you at a conference, and I had already had knowledge of PEMF technology, but I had never seen a portable unit like the MD Cure, and took a couple home with me after I had read your research, and I was amazed again at the results when I started using it.
How long have you been using it?
It's been a little over a year that I've been using it.
Can you share with us your experience, clinical data with your patients?
Absolutely. The first patient actually I put one on was one of my top athletes, who is a former professional runner, sprinter, turned professional football player, now bodybuilder, who suffered with some really, really bad back pain. And again, when we're dealing with athletes, we have to take their pain scales with a grain of salt because they will minimize it. He would walk around somewhere around a 4 out of 10 pain, which to you and me is probably a 7. I put a unit on Keith, started using it exactly how I instructed him to, and within a week, he told me he was waking up with 0 to maybe a 1 out of 10 back pain, which I had never seen with him in his entire career.
How is a MDQ device compared with other PEMF devices that you are familiar with?
You know, the beautiful thing about the MD Cure is it's portable. The other PEMF devices that I've seen, the clinical ones, they're big, they're extremely expensive, they work, but they're not portable. The patient can't take it home, they can't take it on the road, in a plane, in the car, while they're walking the baby, grocery shopping. There's nothing else like this device on the market that I've seen.
So if I do take the MDQ device as a PMF and I compare it to the TENS device, are there benefits to the MDQ device compared with TENS?
Oh, it's night and day. TENS will give you very, very temporary pain reduction, and that's it. You may get a half hour, you may get an hour of pain reduction from TENS, but TENS is not going to knock the inflammation out, and it's definitely not going to help the cells heal and recover faster. PEMF and the MD Cure is going to do that. And again, the beautiful thing, you can use it anywhere, anytime, and it's without a problem, and that's why I love it.
How often do you need to use it in order to get clinical benefits?
Sure. Typically, what we want to do is we want to use the device twice a day. It runs a 30-minute treatment, and we want to do that for 6 weeks. As I've told everybody, no matter how good you're feeling, even if it's after a few days, you need to use it twice a day for 6 weeks. And after the 6-week initial use of it, then we're going to go down to more of a maintenance use 3 times a week, 4 times a week. It just depends on the person. But I've recommended to all my people, once we've gone through the 6 weeks, use it at least 3 times a week just to maintain what we've already achieved.
Dr. Fildler, could you please explain how Aerotel device help professional athletes to relieve pain?
Absolutely. The pulsed electromagnetic field therapy by Aerotel is going to decrease the athlete's pain. It's going to decrease the inflammation wherever it's being used. And most importantly, it's going to help the cells and the tissues recover faster, which to an athlete is everything. The faster they can recover, from training, from a game, after a fight, a long ride, it doesn't matter. The effects in the athletic world and the attributes of this device in the athletic world are going to be game-changing, no pun intended, but it is going to change things, and I've already seen it with my athletes. I've seen athletes training harder, recovering faster, and doing more things than they've ever been able to do in their careers.
Dr. Fildler, as an expert in sports medicine and rehab, how do you see Aerotel's device help to your patients?
Again, this device is a game changer. They are healing faster. It's going to make the rehab go quicker. If it's an athlete, they're recovering so much faster than I've ever seen, from pain levels, inflammation levels, and just overall healing levels. I've been doing this for 18 years, and I've never in those 18 years seen results with athletes like I do with this device.
Dr. Fildler, are you familiar with other doctors that are using our device?
Yeah, absolutely. I know of a bunch that are. In fact, I know at least 10 NFL chiropractors right now are using this device. I can't mention who, I'm not going to mention teams, but rest assured they were impressed enough with the technology that they are now starting to use this with those teams and with their patients.
I would like to mention that Aerotel is a corporate member of the American Chiropractic Association.
Absolutely, and it's because of that membership that I met Aerotel, and I'm extremely appreciative of that.
Dr. Fildler, how important is a PEMF therapy in the sports world?
PEMF is, again, to use the pun, it is a game changer. It is getting athletes back on the field, back in the cage, doing whatever they do that much faster. And when you're dealing with somebody who is making millions of dollars and to a team is worth anywhere on a low end $25,000, $30,000 a game, up to some players $1 million a game. If they're not on the field, that's costing that team money. They are paying that player to sit on the bench. PEMF therapy is going to get that athlete back on that court, back on the field, back in the cage, doing whatever they do that much faster. It is going to save time and it is going to save money for that team.
Dr. Fildler, outside of the sports world, how do you see the benefits of using pulse electromagnetic field device for white-collar employee?
Sure. Well, most white-collar employees are stuck behind a desk all day, so they're sitting for prolonged times. They suffer from low back pain, or neck pain because they're on the computers, they're hunched over. So the ability for them to decrease their pain, heal faster, their productivity is going to go up, missed work days are going to go down, which overall, that's a cost savings to the system. And the beautiful thing is they can use it right at work. They can be sitting at their desk, put the unit on wherever is bothering them, and continue to work and be effective while they're getting their therapy.
Can a Aerotel device be helpful also for blue-collar employee?
Oh, absolutely. I mean, blue-collar employees they're laborers. They're working hard. And again, back pain, neck pain, joint pain is a huge problem in that industry. And the fact that they can use this therapy to heal faster, whether it's at the end of the day, whether it's while they're still doing their job, some of them will be able to actually have the device on while they're doing it, depending on what it is they do. But again, it's going to decrease missed work days, it's going to decrease their pain, increase their healing, which once again, what does that come down to? Cost savings. I also have a patient of mine that is a laborer. He does construction work. again, would have to take breaks. He was missing days because of his back pain. And even with what I do from the chiropractic standpoint and other things, it helped. It just wasn't getting him where he needed to be. Started having him use the PEMF unit at home every day. And within no time, he's back working. He's feeling good. His productivity is up. His boss is happy. He's not missing days of work. He's getting his job done. And that's a fabulous, fabulous thing.
Dr. Fildler, how do you see Aerotel's device beneficial for women?
Well, you know, the beautiful thing is female patients are much more apt to do what it takes to get better. They are the ones that push things in the healthcare industry. They will be the first ones when something isn't feeling well, they will go do something about it. The fact that they can use this device, again, you can still be that active female and use this device to decrease your pain, to help heal. And, you know, I'm going to be real interested to start seeing how it is helping women in all aspects, whether they're elite athletes, whether they're the stay-at-home mom, the white-collar worker, the blue-collar worker. It's going to be huge. And truthfully, it is my female patients right now, more so than anybody, that are really driving this.
Dr. Fildler, is the Aerotel device beneficial for baby boomers?
Oh, I think it's going to be huge for baby boomers. You know, people are living longer, they're staying active longer, and at the same time, the baby boomers are getting to that point where they're starting to retire, they have more time to do things, and if they can stay healthy, they can stay pain-free, they're going to stay active, and that's a good thing. And if they're pain-free and they're feeling good and they're staying active, that is going to decrease the overall cost to the healthcare system because they're not going to have to take pain medications as much. They're going to be able to get out and walk and do the things that they need to do, which in turn is going to keep them healthier. They will lose weight. Some of them, if they can be that active, may be able to reduce other medications because they're exercising, and that's what it's all about. I really see this device changing everything within the healthcare system and becoming a huge cost savings to the overall system. You know, for example, you know, baby boomers, most of them now, they're grandparents. And there's nothing worse than a grandparent that can't lift their grandchild because they have chronic pain or because they've got a new injury. Being able to use the device to take care of those things and spend that quality time with their grandchildren, and quality of life is everything. Again, it's going to change the outcome of life for all of them.
Dr. Fildler, I would like to summarize the interview and ask you to provide the key messages of our Aerotel device.
Sure.
What are the 5 top key messages that you can provide?
You know, the first is ease of use. It is so easy to use the device. There's nothing to set. There's no knobs to move. You can use it yourself. You don't need assistance to do that. And, you know, it's nothing more than put the pad over the area that you want to treat, hit the on button. It'll go for a 30-minute treatment. It'll turn itself off. You can be active while you're doing it. You can sit on the couch while you're doing it. It doesn't matter. And being that easing makes it amazing. The next would be its effectiveness. The results speak for themselves. Being able to use a device that gives not only pain relief, knocks out inflammation, but actually helps the body and the injury heal, that says it all. There's nothing else out there, you know, I've seen and I've used that is this effective, that works like this, and again, that's this easy to use.
And return faster to work or to your sport activity?
Absolutely, you know, to everything. You know, and again, work can be, hey, I'm a mom. Well, your work is huge, you know, whether it's taking care of the kids, cleaning, cooking, just normal activities of daily living is everything. And, you know, again, time is money to everybody. And when you don't have to take time off from things, it's going to be a great day.
Dr. Fildler, is it one size fits all?
Absolutely. Whether it's an elite athlete, whether it's a CEO of a corporation, whether it's a construction worker, whether it's a stay-at-home mom, pain is pain, time is time, and pain costs time, and pain costs money. End of story. And I don't care what your job is. This is going to help, and it's going to be a huge cost savings. You know, the other beautiful thing is overall, when you look at what it does, the cost that it's going to save up as opposed to other treatments, other medications, whatever it may be, time, the unit is extremely cost effective. And if you have an HSA, an FSA, anything like that, you can use those dollars to purchase one, which is going to be even better. And it makes it really easy. And in the long run, what's it going to mean? There's going to be more of those dollars in your HSA and your FSA to use for other things. You know, chronic pain and even acute pain is a huge cost to the industry, to everybody, whether it's the healthcare industry itself, whether it's the person. And this unit by Aerotel is going to save money in the long run. No questions about it. You know, and as a reminder, pulsed electromagnetic field therapy, especially this unit, it's a very low frequency, it's a very low energy, it's extremely safe. Now, this is not going to be seen on late night TV. This is not those little TENS units that, you know, people are buying for, you know, very inexpensively, that really, again, don't do a whole lot except temporarily knock out a little bit of pain. PEMF is going to help heal the injury. It's going to knock out the inflammation as well as knock out the pain. I've worked with multiple teams, multiple athletes of all different genres, men, women, football, hockey, baseball, tennis, golf, mixed martial arts, which has really been amazing right now. I have had results with some of my fighters, including the 125-pound female women's world champion, Barb Honchek, who used this unit while she was training, and she recovered her exact answer to me when I said, "How are you liking it? What are you seeing?" She said she recovered faster than she ever has. This was her second title defense, faster than she ever had in any camp. She was able to train harder. She was back in every single day going harder. And again, to be able to do that as a champ and know, hey, I can push myself to another limit because I know when I'm done at the end of the day, I'm going to use this device, and the next morning I'm going to wake up feeling better than I know I did before I ever had anything like that. It's amazing. And I was thrilled when I heard about that.
Thank you very much, Dr. Fildler. It was a pleasure.
My pleasure. Absolutely. Thank you for having me.